Hello, and welcome to everyone to the responses that I got from the questions from our recent webinar on 3D printed active memory aligners. I want to thank the people who took the time to ask the questions, and I will try to answer them as best as I can within the knowledge that we have gathered in the past 3 or 4 years. So this was a webinar that we posted on the 5th and the 8th of December 2025. The attendance was very good, and I really appreciated the fact that people stayed until the end. So again, thank you very much. First question, given the thermally activated behavior of shape memory polymers, I discussed active memory, not shape memory, used in the next generation aligners, what extent do these time-dependent biomechanical characteristics affect the predictability of tooth movement in the early versus the late stage of activation? So we talked about that, and this is a great slide from Harry Zhu, the head engineer at LuxCreo, who's done some interesting testing the behavior of the aligners in days. So you can see that day 1, day 2, day 3, day 4, day 7. So we assume that we had a 7-day wear for one aligner. And what happens is when you get the aligner into your mouth on the first hour or two, then immediately you can see there is a significant drop in force. So you have a bit of a high force at the beginning for a very, very short period of time, and it relaxes very, very quickly. And then you maintain the aligner, which is active memory polymer, into this narrow range of 6 to 4 newtons for the 7 days activation. And yes, you can see that it fluctuates a little bit. So you get a bit more force on day 1 than you get on day 7, but it's a very gradual loss. And this was another graph that I produced, and I said it's for illustration purposes with a thermoformed aligner, which is the blue dashed line. You will see that after 2 days or 1 day, or depending on the material you're using, you're coming down to a very low force delivery, and it keeps on losing a little bit, but the main stress relaxation or loss of force comes from day 0, which is the day you insert the aligner, until day 2, and then you get into a very low force system. So then the question is, should you change every week, every 2 weeks? That's not the discussion for today. But then if you look at fixed brackets, they will lose a little bit, 90% of the force over 14 days. And the reactivated aligner in green, as we showed in Mr. Zhu's slide, will regain that. So they start lower and they lose the same. As you can see, the slope is almost the same. So they lose their force pretty quickly, but then they're being reactivated every day for a small loss of force over 14 days. Again, you could argue the green line could be a little bit more slanted because obviously after 14 days, you will not get exactly the same force delivery. So the point of these two slides is that the reactivation is the main component. The polymer will reorganize the polymers into the aligner and bring back the aligner almost to its original shape. Remember also that aligners do not necessarily give you as much force at the PDL level, or pressure I should say, than conventional fixed orthodontics. So theoretically, they may require a bit more force because quite a lot is lost within the material, but the reactivation will give you continuous and constant force, similar to a night-eye wire or an activated elastic, I would say, to give you the correct moment to force ratio. So we go back to this moment to force ratio with the next question. Decreasing force will increase the moment to force ratio, but on the diagram, the whole moment to force ratio was decreasing over time. It's true and it's not true. if the moment-to-force ratio, as described by Burstone, is a direct result of the moment equals F times D. So if the force decreases and the distance stays the same, the moment will also decrease. What I was trying to say here is at the beginning, before you have stress relaxation and reactivation, if you use an active memory polymer, but let's assume just for thermoform for a minute, what really happened, the counter moment, which is necessary for translation or for torque, will decrease because of stress relaxation. So it will be very difficult for the aligner to give us the correct counter moment to get a pure translation. This is why we tend to avoid translation movements with aligners, and everyone that I've read seems to say that the most predictable movement with aligners is uncontrolled tipping or controlled tipping, because the moment-to-force ratio in these movements is pretty low and easily achievable with aligners. So to go back to the question, my diagram was showing that the moment-to-force ratio was decreasing over time because the force was decreasing. So the moment was also decreasing. The problem we have then is say, well, wait a minute. If the moment-to-force ratio decreases but stays fairly constant, I could get translation. But in reality, if you want to get a canine to distalize or to show translation in an extraction space, as an example, you still need a fairly high force, which decreases dramatically, decreasing the moment, decreasing the whole power of the system. So that's the problem with the moment-to-force ratio with aligners, is it's very difficult without reactivation to maintain a fairly high moment-to-force ratio, the moment being the counter moment that is necessary to eliminate the one you don't want, which is the moment given by the force. So basically, you need a polymer that has the capacity to give you a fairly high force to move the tooth in a translation way, and you need a moment that can cancel the inherent rotational moment produced by the force. So this is why you need fairly high moment-to-force ratios, 10 to 12 for translation, and you also need an aligner or a polymer that can deliver the counter moment to cancel the moment you do not want. So this is the explanation. You have a 18 when you put the 18 being for torque, 10 to 12 being for translation. You can see that with thermoformed, you will get a fairly high moment-to-force ratio because the polymer is very rigid. Unfortunately, stress, relaxation, and creep will take effect, dropping to about 10 after 10 hours. And after 24 hours, you're almost at 6, which is controlled tipping, and that's all you can expect. So, and then after, I would say, 50 hours to 3 days, you get into 3s, which is what uncontrolled tipping will do, and the polymer or the thermoform aligner cannot give you an 18 moment-to-force ratio due to stress, relaxation, and creep. So this is why we need thermal reactivation. You can see in blue that the force keeps on dropping and dropping and dropping. So yes, you have a moment-to-force ratio potential, a very low force, but you cannot have a counter moment. So that's the big problem. If you restore, you can get a fairly good profile between 100% on day 1 to about 90% on day 7. So this is constant force, constant moment, constant movement. If reactivation daily, it will be painful for patients. I don't understand explosive, but what I'm saying is here, it's a bit different. Remember that in the movie I showed you, we are dropping the LuxCreo polymer into hot water. So the polymer will be fairly warm. You can't put it at 60 degrees in the patient, in your mouth. That's not a good idea, but it will be fairly warm and slowly go down to body temperature, delivering the force. So yes, there will be a little bit of pain or a little bit discomfort at the beginning, but not as much as you think, because the aligner is englobing all the teeth and distributing the forces over all the teeth. Some of the teeth are actually not activated for movement, so this will absorb a lot of the energy. So it should not be painful. It may not be a little bit uncomfortable for like 20 minutes or 15 minutes. You can feel a bit of a pressure probably, but I don't think it would be painful due to the way the polymer is reactivated. The last question we had while doing treatment planning with ActiveMemory polymers, meaning the simulation software, how much translational movement and rotation per aligner? The same as thermoform, or can we add slightly more movement rotation per tray? Well, that comes to the very, I would say, crude method of simulation software are now being programmed, meaning 0.2 millimeters per tooth and 2 degrees of rotation and maybe 1 degree of torque. That's a personal choice, but that seems to be the, I would say, the accepted method. What happens is you have to look at the dentation. Every single tooth has a different root, different length, different PDL. So having just a very crude method like this, it may not be the best idea. Having said that, many people with ActiveMemory polymer usage are actually experimenting due to the daily reactivation and the inherent elasticity of the material when it's reactivated to slightly move to, let's say, 0.3 millimeters. If you want 0.2 with thermoform, maybe you can try 0.3, because every day it will be reactivated and you will get a new aligner. So basically, probably you can go to about 30 to 50% less aligners than you would do with thermoform, because you can incorporate slightly more translation or slightly more activation, I should say. For rotation, it depends on the shape of the tooth, but I would also argue that due to reactivation, we can most probably go to, again, 50% more, 0.3. Some people even go to 0.5, which may be too much. We need more research to really make sure that increasing the amount of movement between stages will not result in uncontrolled movements. But at the moment, I would argue that going 0.3 millimeters, if your regimen is 0.2, makes sense. Again, keep in mind that a canine has a much bigger root than a lower incisor, and keep in mind that if you want tipping of a lower incisor, this movement is far easier to achieve than if you want to translate an upper canine. My point is that the simulation software will become more adapted and will suit better the ActiveMemory polymer that we are using now. And when this transformation takes place, we will bring the individualized movements using machine learning process, simulation software, or activation regimen to the light and further transform aligner therapy. So I hope I answer your questions correctly. If not, let me know and I will try to do it again to make sure that everyone understands the difference between thermoform and ActiveMemory polymers and the potential these polymers present for the next generation of aligners. Thank you.